I would like to deal with three cancers which are not commonly related to sexual activity. Now, it is observed in most clinical practices that although prostate is an immensely common disease with tens of thousands of deaths or 15,000 deaths a year in the United Kingdom, and it's not one of those cancers which has a stigma of viral transmission and sexual transmission. However, it's not unusual to find the patients who have prostate cancer, their wives have had cervix cancer. We're talking about an elderly population who were not immunized for cervical cancer, because prostate cancer occurs in men from, in fact, 80% of men at 80 have some sort of prostate cancer. But it's becoming more apparent that HPV virus is there in patients with prostate cancer. Now, all cancers, and I want to emphasize this, are multifactorial. It's not only the HPV, it's the HPV, it's other etiological agents which we don't understand. But usually a cancer is multifactorial. So there is HPV. Now, as regards penile cancer, thank goodness that it's decreased to minimal amounts. But in countries such as India, it is still a very common cancer. And there is no doubt that where you've got, it doesn't take much imagination, where you've got a high incidence in a poor country of cervical cancer, where you've got millions or billions of people who have slipped through that immunization net. So where you've got a high incidence of cervical cancer, you're going to get a high incidence of penile cancer. And so HPV is involved in both of these, we would put in parallel. Now, I just want to mention liver cancer here, which of course is not related to my previous examples, but you will know that you have hepatitis A, B, and C. There's three types of hepatitis that we have diagnosed and done a lot of work on. Hepatitis A is food transmission. So you eat something which has got hepatitis and you get hepatitis B. You get jaundice, you get over it. Hepatitis B is sexually transmitted very much in the way of HIV through body fluids. But the difference is between hepatitis B and AIDS is probably 50 times more effective. So it can even be transmitted in saliva. Hepatitis B, saliva. It is so infectious. Now you will then say to me, well, what's that to do with cancer? Hepatitis B, if it's not cleared, will lead on to inflammation and scarring of the liver, and that could lead on to liver cancer. But it starts with the original hepatitis B infection. Now we find that 2% of hepatitis cases roughly are hepatitis C, and that is transmitted by blood transmission. Now, obviously, blood transmission, it doesn't need much for people to examine, to think or understand that blood transmission can be through sexual activity. Not often, and we wouldn't put hepatitis C in the same bracket as cervix or AIDS, we're talking about minutiae. But these three things ought to be mentioned because, again, we're seeing a virus and an endpoint of a cancer. And so there is a link. So we're seeing by these three examples, which are not terribly documented and important, how important viruses are in the etiology of malignant disease. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.